Hi guys, in this video I will be covering the situational judgment of the UCAT and in particular what not to do in each scenario. So starting off, we have you shouldn't prescribe medications or give reports to any patient if you're a medical student. This is because you won't have enough knowledge and you won't have enough experience, and if you prescribe something, things can potentially go wrong because the lack of knowledge and you're not trained enough. So therefore you should not prescribe medications or give reports at all if you're a medical student. Next up, you should not inform friends, family of patients without patient's consent. Let's say if the brother of the patient who is diagnosed with cancer asks if the patient is all right, then if you don't know what if the patient has given consent, then you can't tell that brother because the patient might not want anyone to know about his condition. Therefore, you should not inform him. So next, you should not lie at all. For example, if you're going to be late to a placement and you ring up saying, oh, I'm going to be late because I'm ill, then that wouldn't be the right thing to do. And also, you shouldn't cover up for someone. This also goes into the lying category. So for example, if someone hasn't done any work in your project, and they have to do some work to be able to pass, then you shouldn't cover up for them just because they're your friend, because that will lead to a wrong assessment of the student. Next, you should not carry out procedure on a distressed patient. This is if you're a doctor or if you're a nurse or something like a medical practitioner. You should not carry out procedure, for example, if like you have a child who is scared of needles and you need to take a blood test. If they're getting distressed, then you should not force the test, because this could potentially lead to the patient losing trust in the health profession, which can be really bad for any future interventions with the health profession. Next, you should not regard reputation or previous actions. In terms of reputation, if you see a senior doctor, a consultant who is known to be a very good doctor, very capable, and you see him drinking alcohol during the working hours, then you should not take into regard his reputation. You should not say, oh, he is such a good doctor, I must have seen something wrong. You should still report, because this can be very important. And in terms of previous actions, for example, if a patient is known to have very strong emotions and he's crying in front of you, you should not say, oh, he always does that. You should still go, because the patient might actually need help. Next, you should not escalate to higher authority without solving yourself. This comes up a lot in group projects. For example, if a member of your team isn't doing the work they're supposed to do, then you should not report them straight away. First, you should try to solve it yourself. So you should approach to them privately and try to solve the problem yourself. Ask them why they're not doing the work, instead of just reporting them to a higher authority such as a teacher. Next, you should not accept expensive gifts. This is for doctors. So for example, if you have treated a patient and in return they want to give you something, they can give you, and you can accept it if it's a inexpensive gift, if it doesn't cost a lot. But if it is expensive, then it could potentially they could potentially ask you for any favors in the future. For example, they might say, oh, I gave you that expensive watch, and can you prescribe that medication for me? And this would cause you to probably cause you to prescribe that medication which you are not meant to do, this could potentially harm the patient, which will be bad for the patient. Therefore, you should not accept any expensive gifts. And also, you should not keep quiet. For example, if a mistake has been made from someone, you should not keep quiet. You should report as soon as possible, um, so the patient, the harm that is done to the patient is minimal. And also, if you can't cope, if you're struggling with the workload that's been given to you, for example, as homework from a placement, and you can't cope, then you shouldn't keep quiet. You should report it to the person who is in charge of taking care of you. And also, if someone has cheated, if a friend tells you that, oh, they have cheated in that test, then even though they're your friend, you should still report to them, because if you don't, then it will be unfair to everyone, including yourself. So you should report as soon as you can. These options that I have gone through, and if they come up, they would usually be either the very inappropriate ones, or either not appropriate but not awful. So if any of these comes up, make sure you choose one of them options and not the more appropriate ones. Thank you for listening.